Hi everyone, I am sharing with you a small video which basically describes the approach that I used to solve the questions wherein we were expected to diagnose the emergency situation in a clinical judgment exam. Please note that this is not a tutorial and I used this approach only when I was thoroughly clear with the theory involving all the emergency situations. You need to know the basics and there are no shortcuts. So, this video is definitely going to help anyone who has completely gone through the theory and the concepts. And the aim behind making this video is it will help you save time in the exam by helping you make an approach to solve the question in a manner that you are not leaving any information. Because when you're sitting in the exam, you tend to get confused because of lack of time. So, in order to help you not to forget any information and do not miss out any important consideration, I hope this approach helps you or help you make an approach for yourself in another way. So, basically, whenever you have a situation in the exam, the information will be very concise and they may give you some vital signs or they may not be there. The chief complaint will be there. And most commonly, once you diagnose the situation, the following question expects you to do the management. Be mindful whether the question is asking for the initial or the appropriate management. Now, this is not in the scope of this video. We are basically considering the diagnosis because if we get right, most often we are if we are not faltering on the diagnosis, the management usually follows and it is most of the time correct. So let's see. The approach that I used was to always note these four important things. So whenever you get a question, make sure that you recall all this information so that you're not missing out on anything important. All of this may not be present, but you have to look at what all clues you can find. So, firstly, what is the chief complaint? The chief complaint that the patient is experiencing on the dental chair at the time of emergency. Okay. Now, the chief complaint of the main history. Secondly, you have to note exactly when the situation happened. So, was it during the examination? Was it during the administration of injection? Or was it during some traumatic procedure? You have to note the time. Thirdly, always go back and look at the medical history and vital signs if they are given. Compare it to the base vital signs which are present initially. And lastly, you have to note what does the question mention that there was involvement of any stress. They may usually say that the patient was undergoing a stressful procedure like a traumatic wisdom tooth extraction, or they may say the patient was anxious. Please note that you have to always look for these four things in the question. What are the different chief complaints that can present at the time of emergency? Chest pain, difficulty in breathing, patient suddenly losing consciousness, patient experiencing seizures, altered senses or delusions, some skin reactions like redness or swelling, some neurological signs with tingling in extremities or paresthesias, excitement. The patient may just feel some fear of death, or he may start sweating and having palpitations. He may say that I'm having the feeling of impending doom. Sometimes, clearly, the questions say that the breathing or the pulse both are missing. So, loss of vital signs is a clear sign of cardiac arrest. Less commonly, patient may present with abdominal pain or headache. These are the different type of chief complaints that you can see at the time of emergency. Now, when did it happen? We've already discussed it can happen during any time. Why this is important is, for example, if the emergency is happening just during the the examination, so of course you're not going to consider any allergy, you're not going to consider any toxicity because the injection has not yet been given. So that is why the timing is important to note. Thirdly, you have to look at the medical history. There are many conditions where a patient is more prone to develop a particular emergency. For example, the patient with a history of angina or MI is more likely to have an anginal attack at the time of the procedure because of the stress. So it's very important for you to know the medical history. Whenever you have an emergency question, go back to the history and look for any condition which is already present that makes the patient more susceptible to develop that particular emergency situation. For example, asthma attack. Go back, look at the history. Is asthma present, right? It not necessarily means that the patient who's experiencing respiratory distress with a history of asthma, it is only going to be asthmatic attack. No, this is not what we mean. The point is you have to look at other things also, and that is why you have to follow the approach, right? So diabetes mellitus, obviously chances are there patient may develop hypoglycemia, but it may just be a simple syncope, right? So you have to not just look at the history, you have to look at all the four things that we're talking about. Seizures, most commonly seizures, if the patient has a history, then it will be an attack, right? A seizure attack, epileptic attack. But with a no history, yes, you can think of LA toxicity. Look for some risk factors if present in the history and the patient experiences severe headache, right? You can suspect stroke, cerebrovascular accident if the risk factors are present. It can just support your diagnosis, right? A history of hypertension you have to look for. If you're suspecting hypertensive crisis, patient must have the history of hypertension. Now, you can also get help from some history like allergy, and a patient is having history of anxiety. So they may help you if you are suspecting a panic attack, hyperventilation, or syncope. Now, let's see the importance of vital signs. Always note the vital signs if they are given. Sometimes they don't mention, but if present, it can be really helpful. And you also have to note that the heart rate increase or decrease, whether it is slight or it is significant. I'll give you an example here. When you have increase in blood pressure, mostly it happens at the time of angina. You look at the blood pressure, it is increased. But when the patient is experiencing chest pain and there is myocardial infarction, the blood pressure may or may not change. So these are not hard and fast rule that these values are going to increase or decrease, but definitely they can be very helpful to note, you know. So you have to be mindful if this information is given, is it relevant or is it, just present to confuse you? But yes, you have to note these points. Now, the approach that I followed will be basically, concentrating on the chief complaints. So let's see. So what I did was I wrote the chief complaints and I wrote what all situations can be associated with that chief complaint. So, and then I use the other information to rule out the different causes that can be possible and to finally, be sure of my diagnosis. For example, first of all, let's talk about chest pain. Now, when you have a chest pain, these are the five conditions that you can suspect most commonly, right? So, angina, myocardial infarction. You can also suspect that patient is just having some indigestion, right? Non-cardiac chest pain. It can be less commonly hypertensive crisis or a case of hyperventilation. The patient is experiencing anxiety. They may also feel some chest discomfort and say that I'm having pain in my chest, right? So let's see how to rule these out. So, angina. You can safely mark angina if you see that in the medical history there is a history of angina or myocardial infarction. Safe to mark angina. If the history has these two and the question mentions that the pain was not relieved by nitroglycerin, then it is safe to mark myocardial infarction. Non cardiac chest pain, basically, they will mention something like the pain was increasing on breathing or on movements, right? Or the patient gave the history of, when you look at the history, there is some history of indigestion, some gastric issues. So you can suspect non cardiac chest pain. Then, less commonly, hypertensive crisis. Well, the hypertensive crisis comes as a diagnosis. You look at the medical history. If you see the history has hypertension, and the blood pressure reading is also given, it is severely increased, they will mention the value of blood pressure at this time to help you reach the diagnosis of hypertensive crisis. So any blood pressure which is more than 180 to 200 mm systolic and more than 115 diastolic is clearly an indication of a hypertensive crisis. Lastly, hyperventilation. Most commonly, they will mention that the patient is anxious or there was some traumatic procedure, but be mindful that for you to mark hyperventilation, increase in respiratory rate is a more important sign, right? Rather than chest pain. The patient can just feel discomfort. You cannot say that he's hyperventilating. So they will mention. So just look if they have mentioned anything which is relating to the increased respiratory rate or they've given a value, then you can safely mark hyperventilation. Now let's talk about respiratory distress or patient experiencing difficulty in breathing. This can happen in the following situations: asthma, foreign body aspiration, anaphylactic attack, or if the patient is hyperventilating. Now let's see how we can differentiate between these situations. Now, if you're suspecting an asthmatic attack, go back and look at the history. The history of asthma must be present. Now, the respiratory distress can also happen in the patient who is having asthma, and it cannot be asthmatic attack. So, look at everything. It may be an anaphylactic attack. So, in that case, severe drop in blood pressure will be mentioned, right? So, you have to look at everything. Secondly, if you're suspecting foreign body aspiration, look for some clues in the question, like is it mentioning that the patient was getting the impression done and then he started having all these symptoms. So maybe a part of the impression material has gone in his throat and he started choking on that. So this information will help you to reach this diagnosis. You can also have respiratory distress and go for your diagnosis anaphylaxis. Make sure that you know the classic signs of anaphylactic shock: severe hypotension, laryngeal edema, and sometimes they mention generalized warmth over your face or your chest area. So uh, you have to be mindful that anaphylaxis can happen. Some skin reactions happen and then it goes towards the anaphylactic shock, or it can happen immediately. And lastly, you can suspect hyperventilation. So in this situation, look for the procedure if it is stressful or the patient is the patient anxious. And hyperventilation, as we discussed, that increase in the respiratory rate, like more than 20 breath per minute, something like that, must be mentioned for you to reach that diagnosis. Another very important and very commonly seen scenario that is presented in the examination is a case of loss of consciousness. And these are the five conditions that can be associated with loss of consciousness, like syncope, postural hypotension, hypoglycemia, adrenal crisis, or cardiac arrest. Now, when you have to mark syncope, look for the heart rate and the blood pressure. When the patient is experiencing syncope, the heart rate is decreased and the blood pressure is also decreased. Now, the management is important. If the patient is experiencing loss of consciousness in syncope, you have to call 911. Otherwise, it is manageable by taking care of the position and you can also give some sugar source to the patient, and he should be fine. In postural hypertension, for diagnosis to be made, you the question will mention that the patient was sitting on the chair and suddenly he stands up and then he goes unconscious. So change in position is important if you have to reach the diagnosis of postural hypertension. For hypoglycemia, look if there is history of diabetes mellitus present. However, it is not it is not a fact that hypoglycemia can only happen in diabetes patient. No, it can also happen in someone who is non-diabetic, but yeah, it is less common. How to differentiate it from syncope? If they have mentioned the heart rate, because in hypoglycemia the patient experiences increase in heart rate and decrease in blood pressure. Also, they can give you sometimes the sugar level. So please note, you have to know that what are the values. For example, less than 85 milligram per deciliter percent, or you have to know all the conversions in millimole, etc., using the finger stick method. Less commonly, they can give you adrenal crisis, but look if the patient is taking steroids, not very commonly seen in the exam. And cardiac arrest, no pulse, no breathing, safe to mark cardiac arrest. Just to differentiate a very common, the confusing scenarios when the patient is experiencing sudden loss of consciousness, is you have you most of often the we get confused between syncope and hypoglycemia. What are the factors that can help you here? Note the heart rate if it is given, because it is increase in case of hypoglycemia and decrease in case of syncope. The blood pressure decreases in both the cases because the patient is losing consciousness, right? You can also take help from the sugar levels as we discussed. Coming on to seizures. Seizures is the patient starts having, the attack. And if the patient's history, so these are the conditions where the patient can have seizures. If a history of seizure disorder, also in cases of LA toxicity, in severe hypoglycemia, less commonly in cerebrovascular accident, and very less commonly in syncope also. So seizure disorder, if the history is having any condition like epilepsy or seizures, you can suspect LA toxicity if there is no history of seizure, and the question will mention that the injection was given. Now, this toxicity can happen with a single injection, with a multiple injection. That information is also important. In severe hypoglycemia, look for the history again for diabetes. And in cases of stroke, the severe headache must be present. And syncope, they will give you some more information. The patient cannot directly start having seizures in syncope. Definitely, they will give you some more information. So, mainly in this case, you can suspect seizures or LA toxicity. Coming to altered sensorium, this basically means that the patient starts behaving in a bizarre way. He's not having proper senses. He's sort of having some delusions. And this can happen in different situations like hypoglycemia, adrenal crisis, stroke, seizures before having the attack, the stage of aura, and hyperthyroidism. So let's see how we can rule these out. So hypoglycemia, again, the same things, the medical history, adrenal crisis also, the medical history. For the stroke, look for some risk factors, and seizures, again, look for the history. Hyperthyroidism will, again, history. So see how important it is for us to look at the medical history along with the other conditions, right? To rule out the different, probabilities that can present with a particular chief complaint. Abdominal pain. These are basically four conditions where I found the patient can present with abdominal pain. the adrenal crisis, hyperglycemia, hyperthyroidism, and even in anaphylaxis. Yes, it is important that even in cases of anaphylaxis, the patient can complain of abdominal pain. However, there are some classic signs of anaphylaxis. Please look for severe hypotension. Okay. Secondly, respiratory distress, right? And thirdly, another important sign which is classic for anaphylaxis is generalized warmth of the body or the chest area. The patient experiences those sign and symptoms. So anaphylaxis is also a very important emergency situation that is frequently asked. Please make sure that you are completely thorough with all the findings that can happen in anaphylaxis. Headache. Now, headache can be associated with stroke. They will mention severe headache, right? Severe sudden headache. Look for any risk factor, safely mark stroke. And hypertensive crisis, they will give you the values because otherwise you cannot say whether, what is happening. So for the crisis, to call it a crisis, you have to have the values. So look for the values, severe increase in blood pressure. Headache can also happen in epinephrine reaction. But to make a diagnosis of epinephrine reaction, the question must say the patient was fine, that recovery happened, because this is very transient. The patient experiences all those signs like headache, flushing, agitation, but then he recovers. And less commonly, it can happen in hypoglycemia and hyperglycemia both. You can also be presented with a case where the patient is experiencing skin reactions. So you can safely see the skin reactions or the allergic reactions are, they can be divided into two. So one is just allergy, drug allergy, where they will mention that the patient started experiencing some swelling of the lips, the angioedema, and patient started sneezing and all those things. So you can mark allergic reactions, but also they can give you some values which show that now the cardiovascular symptoms have started to taking place. In that case, it is more towards pointing your diagnosis to anaphylaxis. So be careful that is it only the skin reactions which are happening, or have they mentioned anything which can make you think of the anaphylactic reaction. If they don't give you a separate option of delayed allergic reactions or something like that, you then have to mark anaphylaxis if either some changes in the cardiovascular system or the respiratory system start happening. Sometimes these signs are also important and given in the examination. They will give you that the patient starts experiencing some numbness, tingling in the sensation, very commonly seen in many emergency situations like syncope, hyperventilation, which patient is anxious, stressful. All these neurological and cardiac signs start happening. Also, in cases of LA toxicity, initially the patient starts having some uh, different sensations, excitement. A very important point about LA toxicity is it mild, moderate, or severe? Because changes in the vital signs differ according to the severity of LA toxicity. Initially, in the mild cases, they will just have excitement, tingling, and all those things. Well, once it's moderate, all your, the vital signs, the blood pressure, the heart rate, the respiration, they will start increasing, and the patient can start experiencing generalized seizures in that situation. And as the further it increases, lastly there will be collapse. In very high level of toxicity, the patient will experience his cardiovascular collapse. So all the vital signs will then start decreasing. So this all this information is important when you are suspecting LA toxicity. Please look for what exactly the changes are and how they can be correlated. The fear or agitation, can this line can simply be there, fear of impending doom, or I'm feeling like I'm going to die. So these can point towards anxiety attack, panic attack, hyperventilation. And this feeling also happens in cases of myocardial infarction. The patient does feel like this in case of anaphylaxis. So, but to remember, they will not just mention this presenting situation, and if they do, they will ask you to reach a differential diagnosis. For you to make one single diagnosis, more information will be present. So just look whatever they give you. They are going to help you by giving some clues to reach your final diagnosis. Last important consideration, where usually you find yourself getting confused, are the cases you have to diagnose. You're confused between syncope or hypoglycemia. So we've discussed this. You have to, you get confused whether I should mark angina or MI, because sometimes students think that if the history is having MI, then the emergency will also be MI. But this is not the case. You always mark angina first until more information is given. And also, we've discussed about whether it's just a simple skin reaction or whether it is going towards anaphylaxis by more systemic involvement, and LA toxicity also, whether you have to see if it's mild, moderate, or severe. Thank you so much. I wish everyone all the best. This is just a small small attempt from me to help everyone, because I thought that some people still were struggling to actually solve these questions. So my aim is to share with you, so that you can get help from what I did. I wish you all the best. If you have any questions, I am going to share my email. So you can send me an email and I will try my best to find the right answer for you. All the best and stay healthy.